Okay, today, I was very grateful for being for the opportunity to talk to you today a bit about our Golisano Institute for Developmental Disability Nursing and more about our fellowship. And I'm very grateful for this opportunity to talk with you and also to get your feedback because it is significant to the work that we do moving forward. So, many of you are familiar with our Golisano Institute. For those of you who are really not, I'll just give you a brief overview of it. And so around 2018, 2017, I was at that point in time, I was the founding dean of the of the Wegman School of Nursing at St. John Fisher University. And, we had a real significant commitment to at-risk populations in our community and in our sort of catchment area, which is rural, urban, suburban. And I also recognize that here in Rochester, because of the generosity of Mr. Thomas Golisano and the great work of the University of Rochester, particular, where Holly was, that there was a focus on improving the healthcare and inclusion and opportunities for people with intellectual and developmental disabilities, both through the University of Rochester, the Golisano Children's Hospital, and then these great community organizations. For example, Hillside, where Holly is a nurse practitioner, where she has her practice working with kids with dual diagnoses. So when I looked at what it is that Mr. Golisano and the foundation were funding, I saw a lot of interest in medical education and certainly in dental education. But what's missing is really any significant focus on the nursing workforce, both in terms of education of nursing students, but also in nurses and clinical practice afterwards. And we do know, we've talked about this a lot, that in general, most healthcare providers, and particularly medicine and nursing now, have very little, if any, education, didactic or experiential education in the care of people with intellectual and developmental disabilities across the lifespan. I've got the good fortune of being a faculty fellow for a number of years at the Waterford Institute of Technology in Waterford, Ireland, and worked closely with their nursing program and found that one of the really unique and very meaningful contributions of nursing education in Ireland is the preparation of people that are referred to as RNIDs. So they're registered nurses in intellectual disabilities, and that is their focus and their specialty and their disciplinary expertise. I think Australia had a program like that. I don't know if they still do. And the university, the UK does as well. But they're one of the only areas that really recognizes that people with intellectual and developmental disabilities, that population is underserved and has very special needs and things that need to be thought about in terms of evidence-based practice, safety, inclusion, recognition of people's individual rights, civil rights, all of that. And so I was privileged to be a visiting professor in that school and then began to see what a difference that made and what expertise there was and how in many ways the population in Ireland was much better served than we had in the United States. So anyways, my recognition, my interest in the area, as well as this great partnership that I had with Ireland, led me to come up with the idea of creating an institute, I should say, directed towards improving nursing education, both for students as well as nurses in the workforce, to provide more optimal care for people with intellectual and developmental disabilities. And I had my colleagues in Ireland to partner with that. So I put together a proposal. We went to Mr. Golisano and were awarded a $5.8 million grant to establish the Golisano Institute for Developmental Disability Nursing. So we get started with great ideas, of course, and then COVID came and hit us, kind of smack in the face. And what it did for us in many ways, in strange ways, it helped us because it forced us to go from what I was going to call a very parochial thinking that this work would happen in a classroom, through didactic learning, through perhaps seminars that we would host at St. John Fisher. And with the advent of COVID, we moved from an on-site to a virtual online institute. And with that, it expanded our opportunities to have more and more relationships and feedback and opportunities around grant writing and evidence-based practice discussions, and to learn from people who had devoted their professional time work, like Sarah Alley, to helping us build the Golisano Institute. So we moved forward and had more and more people reaching out to us because nobody thought an institute in developmental disability nursing was a bad idea. And in fact, we have made so many connections, both with the nursing leadership, but also with interprofessional leadership and opportunities across the United States and the UK. And from that, we've gone forward. One of the you can move to the next slide for me. Thank you. So our mission then for this institute became, rather than just, in Western New York, it really moved to a worldwide collaboration with thought leaders. And I use this term because, I have recognized and had the opportunity to, over my career, to work with people that I recognized as thought leaders who were very connected to the work at hand, but also had a vision for the work of the future. And I recognize people like Sarah Alley as a thought leader, and Beth Marks, and Suzanne Smeltzer, and then I met with Brian Avery and Renata Tika, and we just went on with an introduction to really disciplinary experts in this area who had a sense of practice, policy, education, who are committed to civil rights, who recognized that there were things that we could do as colleagues in an interprofessional collaborative thinking that would move forward health equity and inclusion and the respect of individual and civil rights for people with intellectual and developmental disabilities. So our mission then was to really, we began our focus really on nursing. I mean, I'm a nurse, Holly's a nurse, it's a Golisano Institute of Nursing. And that was the area, the healthcare professional area that we saw were the biggest needs. And we recognize also that nurses, we are the largest healthcare profession in the world. There are, for example, more like nurses across the world providing care. And in some places, nurses are the only care that people have access to, the only healthcare professionals. So though we appreciate and we welcome our interprofessional colleagues and the collaboration that we've done, we began to think that our first and foremost focus had to be on the nursing profession so that we could build a critical mass of nurses who could lead this work moving forward through the vehicles of education, both education of new nurses and nurses that are actually in practice in the workforce, strengthening the systems that provide care and services to people with ID, whether it's a healthcare system or a community system, providing strength in that area, and then providing leadership as well. So those are the vehicles of our mission in the Golisano Institute. Next slide. Okay. So as I mentioned, our work began with thinking about how we could take the healthcare needs and concerns for people with intellectual disabilities across the lifespan and integrate that content into existing nursing curricula. So with the help of Waterford Institute of Technology faculty, they're now called Southeastern Technologic University, still in Waterford, but they're much larger now and have more expansive footprint in Ireland. But with Dr. Sinead Ferran and Dr. Mary Reedy from Waterford, we began the work of integrating content and experiential learning into our undergraduate and graduate nursing programs at St. John Fisher. We then, through the work of Holly Brown, we focused on content and opportunities for the development of the existing nursing workforce. And Holly, do you want to say anything about the Mother Cabrini work that you do? Did I lose Holly?
No, sorry, I'm working with my phone for the audio, and I got you guys on Zoom on my computer. Sorry. Good morning, everybody. I hope you all had a nice Thanksgiving. Sure. So we've been really fortunate to have 2 rounds of funding from the Mother Cabrini Foundation here in New York State, where we've been able to develop, working in collaboration with a variety of folks, including Dr. Alley, on the development of content for licensed nurses working in acute care settings around the care of people with intellectual and developmental disabilities. So I think actually we have spoken to this group before about it, but it just as a reminder, these are several just-in-time modules that a nurse working in a facility, a hospital setting, can take to strengthen their skills around things like communication and assessment of signs and symptoms of deterioration, to think about care and discharge planning, as well as strategies to manage, mental health, anxiety, all the way up through mental health crisis for folks in the population. So we piloted that program with over 100 nurses in Western New York, and overwhelmingly the results of that were so positive in terms of nurses' sense of knowledge, their sense of competence, their sense of confidence in caring for the population. So it's been a real thrill and a nice complement to the work that we're doing overall at the Institute.
And this wasn't a surprise, but when the Mother Cabrini work was launched in some of our regional health systems, we got a request from non-nurses to take the content as well, so we began to see that there was an interprofessional portion to our work that we wanted to build on and be thoughtful about how we would do this moving forward. Still very aligned with our commitment to the nursing profession, and recognizing that our work in the education of nurses, be they students or nurses in practice, that work is very much informed by the disciplinary expertise of many of our interprofessional colleagues too. So we have, we've been sort of poking that with the big stick because, we are a small but hardy group, kind of like Robin Hood in a way. And we want to be cautious about making sure that our work is, that it's committed to excellence and is meaningful to the workforce and really makes a contribution to health equity. But at the same time, we want to broaden the impact of our work, perhaps now with taking more time and an opportunity to have more and more interdisciplinary, interprofessional colleagues join us in our work. Okay, so for the next one. Okay. I mentioned, that we work a lot with our international partnerships and with nursing institutes of higher education across the United States, we would like to have more and more partners from health systems, particularly, for working with high institutes of higher education who have nursing programs or have health sciences programs, so that we can share what we've learned about integrating content into existing curriculum and ways to use, for example, standardized patients like Bridget's work, you know. Have you enjoyed that work, Bridget?
I do. It's really amazing to have people with disabilities involved in this standardized patient. It's very fun
Is
to,
it fun?
yeah,
And are the students only nurses, or do you have students from other health professions?
other students through different health perspectives. So we have the dentistry, the pharmacy, and the nursing.
Mhm.
So we have the nursing practitioner, and then we have the pharmacist, and we have the let me think, the dental student to
Dental
come,
student.
and so they could have experience of working with people with disabilities in um, different health situations
Yeah,
and
yeah.
how to problem solve the situations. So
It's such an exciting opportunity for learning for students that you've provided, in the work in developing standardized patients. And I hope, that we'll be able to learn from what it is that you and University of Illinois at Chicago are doing in this work, and then incorporate it into the work that we do, as well as the ideas that we share with others too.
yes, definitely. And some of the nursing department, some of the students that worked with me actually are graduating alongside with me this
Mhm.
coming 14th of December. So it's exciting to be among all those students. So
So are you graduating on the 14th of December?
I am.
And tell us about that, Bridget.
So it's applied health science.
Mm-hmm.
And so I have a I've been working I have been it's at UIC with Beth Monks is down
Mm-hmm.
low. So um but so the applied health science is the whole west side Chicago area, and the DHD building is closer to there, and that's where I'm graduating from to get my disability studies. So
Congratulations.
thank you.
Congratulations. Yeah. That's exciting, huh? You gonna have a party?
Sunday I am with my family.
Oh, that's great. Yeah. So, there's one great example of, collaboration and, making sure that people with intellectual and developmental disabilities, are there to talk about their experiences and provide, their personal um, ideas around what's going to make things better in terms of the way we teach as well as the way we practice too. So, um, so that's one example of how we strengthen systems, both, through education, but also strengthening the system, the healthcare systems. And we heard a great presentation on that the last time we were together about what's going on with Rush and their disability-friendly environment that they're creating, you know. And then, of course, nothing makes real sense to a practice profession like nursing if there's not a major focus on improving practice and looking for ways through either through research or evidence-based practice work to make sure that practice is improved and it's shared to as as much as we possibly can do, both across maybe the US as well as, across the European Union as well, and anybody else who wants to work with us. A while ago, our institute was asked by Special Olympics to create an introduction to intellectual and developmental disabilities course. And we worked together with our colleagues from Ireland and Canada, and we did this 5-course series for Special Olympics. And I know Katrina is better at this, remembering this than I am. But one of the last times I talked to my colleagues at Special Olympics, they told me that they had just gotten a request from 4 universities in Iran to have access to this 5-course series that we created. And, when we first started with this work, we had Special Olympics, of course, is international, and we wanted to do the best job that we possibly could. And worked really hard on it, talking about health and inclusion and the importance of excellent communication and understanding, the issues around access to primary care, all of those different things. But I never expected that we'd have our work actually posted and being used at 4 universities in Iran, so it just shows that there's a real hunger, a real interest, really across the world on doing a better job in this work and finding collaborative partners across the way so that we can share ideas and share best experiences, and perhaps, come together like we did with the ACL grant, the University of Rush, our Golisano Institute, the Villanova University, the University of Illinois at Chicago, and the University of Minnesota came together and we wrote that grant, Sarah Alley, right? Yeah, the nurses wrote that
That
grant.
was one of the good things we got out of COVID. I mean, because that grant, came out in May of 20. And I
Mhm.
think that, as I recall, when we decided to write for it, we said, well, what's the worst thing that could happen?
They could say no.
Well, that too, but we also said, well, because of COVID, the Golisano Institute had to suspend the think tank. So I said, well, we said, what's the worst thing that happened? At least a core of us will have a think tank over the next 3 weeks. We did that thing in something like 22 days, which we did, and we got the money. Although there may have been some discussion that, one of the worst things is we get the money, but no, that's not.
Yeah, but when we
No,
began,
and we got the money, which has been great. I mean, I think
great.
we really have developed some material.
And
over
that's the
last
money responsible for this
For
work as
this,
well,
for this
right?
work
Yeah.
and the simulation, it's not the only thing. I mean, I think our money was minimal, but it was involved in the simulation stuff at UIC, certainly Villanova, and our
Mhm.
advanced service learning at Rush, which we've covered. And we now have a grant. We got the money from the WITH Foundation to extend the service learning program to DePaul, Michigan State, and UMass Dartmouth. So that was probably, I should have made that announcement at the beginning, but yes, we just got that money last week. Anyway, we got it within the last couple of weeks.
And that group, those of us who started out writing that ACL grant, that got funded, has also led to this international, but work that now we do through our Golisano Fellowship, which is actually what I'm supposed to be talking about. So we can look at the next slide. Okay. So our Golisano Institute in Developmental Disability Nursing is a year-long series of learning events and opportunities for engagement and network development. And that is part of our institute, was one of the major pillars of our institute when I wrote the proposal. So not only were we interested in the development of education opportunities for both the new nurses or student nurses, new nurses actually in practice, but we were also very, very interested in this idea of creating a network of thought leaders across the world who are very committed to the idea of creating opportunities for health equity and inclusion for all people with developmental disabilities across, the age spectrum. And so this is our Golisano Fellowship. We are now getting ready to launch our third round of this. It's a 12-month, and, I'll go back to what I said earlier, COVID really, for all it really helped us, I think, shape something that has much more impact than my very parochial thinking about an institute that would be at St. John Fisher in Rochester, and people would come and study with us for 1 week or 2 weeks. So because we had to do everything virtually, we expanded the population that we were looking for to invite them to apply for our institute. It's 12 months, so we do it over a year, and we have an intensive week in June. And so we're all together online in June, Monday through Friday, the first week, where we have lectures and conversations. People meet together to talk about their interest in projects, their experiences in their own work and practice, and to hear from people like Chewy and Suzanne and Heidi. All of you've been such great colleagues, have joined us at the Institute to talk about your own experiences and what's important to you, which really informs our work, to have the experts with us to talk about the things that we need to do. So first week in June is that intensive week, and our presenters are highly interdisciplinary, interprofessional. And what we've learned from our fellows is that they really enjoy having experts talk to them, but what they like even more is the opportunity to talk together in small groups and large groups when we get together, because there's a lot of passion, there's a lot of excitement, and there are a lot of people who want to tell their stories, what they've learned. So we've spent time, every time we've had a fellowship year, we look very closely at the evaluation we get from our fellows and our mentors, and people like Susan and Chewy, that feedback, and then use it to shape the next opportunity. So between the first week of June and the last intensive week at the end of the year, which is also in June, we have monthly get-togethers online where we might have the fellows talking about the projects that they are doing. So all of our fellows have a project that they must do across this year, focused on something that they've identified as a need or a real interest. And then we assign them a mentor who works with them across the year on this project. So Sarah Alley is a mentor. Beth Marks has been a mentor. Suzanne Schmelzer has been a mentor. And we have mentors here in the United States who are nurses and non-nurses. Brian Avery and Renata Tika are mentors for us. And then our colleagues in Ireland serve as mentors as well, working one-on-one with their fellows on their project. So that's like September through May of the next year. Starting in May, at the end of the fellowship, our fellows present on their projects. So we work with them so that they have a very, well-developed project that has learning objectives and evaluation strategies. And also we ask them to submit a paper that would be eligible for publication or presentation too. So that's how we want to get this information out. It does nothing if it just stays inside of our fellowship, but we want to get it out and get it published, as well as help our fellows learn around that role of being a thought leader, how to get your information out there. We talk about policy, and we have to be careful about policy because we need to talk about international policy. What's happening with the World Health Organization? What's happening with the United Nations? Not just what's happening in our state, and on our federal level. We have to be very careful that we don't think that everything in it that happens is happening in the United States. It's probably the opposite, but we do talk about policy and how to lobby. And we hear stories from people who have done significant work to change access. One of our colleagues who's going to join us for the fellowship as an expert for the next round was responsible. She's an Irish a nurse, doctorally prepared, and she's responsible for the change in policies around employment for people with intellectual and developmental disabilities in Ireland. You know, she was able to fight that good fight, which created opportunities for meaningful, just work that was very important, clearly, from the population. People with intellectual and developmental disabilities in Ireland wanted to be able to work. They wanted to be able to make a living, get paid, and also have the opportunity to be integrated and part of their communities. So she's going to come and talk to us about the work that she had to do to get that law passed. And even though it's passed, and in Ireland, which is a country of just a little bit over 4 million people, what she learned about making a good argument, finding who the influencers were, making sure that people with developmental disabilities were heard, their voices were heard. That's one of the things also that we focus on in our fellowship. So that's kind of where we are now. I will tell you that this year we decided to accept fellows who were not nurses. So this is a major change for us, that our fellowship applications they're still coming in now, but we decided, it was time now, given the major focus on interprofessional education, the importance of the interprofessional workforce and opportunities to build good teams, that we would move forward with accepting applications and admission into our Golisano Fellowship for people who were not nurses. Now, I'm going to stop there because I could talk forever on this. So do you have any questions, comments?